Hello everyone, I'm Dr. Naisha Bonnet. Welcome to my first class. Today's topic of fundamental nursing test taking strategies is one of the most important fundamental principles you should learn and grasp as soon as possible to avoid failing your nursing exams. When you fail an exam, you fall into one of these categories. Category number one, a content problem, means you didn't study as well or at all, and you didn't know the basics of a topic. For example, you don't know how the blood flows through the heart. Side note, please don't throw away all your mental notes on anatomy and physiology. You will need them. Second, you could be dealing with the application problem, meaning this is when you know the material, you know how the blood flows through the heart, but you can't quite understand mitral valve regurgitation. You can't put it all together. You really can't connect the dots to critically think. In the next 3 slides, I will go over 3 principles to always follow when answering questions. So this right here is one of my favorite sayings that I love to say to my student. And it is, you're the nurse taking care of this patient, and you can only do one thing to save their lives. What are you going to do? So in the next 3 slides, I believe they will help you be able to answer this question effectively and correctly. So we all heard of ABCs, right? Airway, breathing, and circulation. We all heard of that. But do you guys know that airway and breathing is not always going to be an answer choice? If it is an answer choice, you already know what to do. But I love this chart right here when it says priority one, meaning this is most important. Airway, breathing, cardiac or circulatory problems, right? And then you have your vital signs concerns, and then you have your lab values that are life threatening, right? Those are things that are priority. Your second priority comes into as your what? Changes in mental status, untreated problems such as a diabetic who hasn't had their insulin, pain, urinary elimination problems, right? Side note, a patient not urinating, that is a serious matter. That is a priority. And I'm here to tell you, if airway, breathing, and circulation and all that stuff in priority number one is not an answer choice, I guarantee you, if that patient is not eliminating and voiding, and they're supposed to be voiding, that is a priority that you need to pay attention to. But anyway, back on topic. Priority 3 is like health problems that don't fit into the first 2 categories. So activity, rest, family coping mechanisms, and lack of knowledge, which are all important things, but guess what? It's not priority. So the nursing process, you will probably learn this in fundamentals, but I believe that the nursing process will forever go with you as a nurse. This is a concept that you really, really need to grab a tight grip on. So first of all, assessment. Assessment is what it is. It is assessing the patient, and it is a collection of subjective and objective data. So that's why you want to be listening to your patient when they're talking, because it may not be data that you can actually see, your objective things, but it may be the subjective things they say. Oh, I feel so fatigued. I haven't slept in nights. Oh, I just feel so weak. Things that you really can't see, but that is pertinent information that these patients give. Your nursing diagnosis. That is what is the problem, right? All right, our planning phase. We then begin to think of how to manage the problem. You come up with the plan. Our implementation phase, you put your plan into action. And your evaluation phase, well, did your intervention work? If it worked, good for you. But if it did not work, you need to start all back over. You need to start back over to see, hey, what did I miss? And why wasn't this intervention successful? One thing is important, always go back to evaluate if you just have implemented an intervention. So let's say a patient's blood pressure was 200 over 100. You gave some IV hydralazine. Hey, don't just go automatically and think that medication worked. No, you need to go back and evaluate, which would be reassessing that patient's blood pressure to see if it even worked, because sometimes it doesn't work. And then guess what? You go back to the planning stage, right? Okay. So Maslow's hierarchy of needs, this chart I fell in love with, because sometimes we get so grounded on our ABCs and the nursing process that we forget that we are supposed to be taking care of the patient holistically. That guess what? Their mind, their body, their soul, their spirit, all that matters to us. But like I said, the answer choices of airway breathing, hey, are not always going to be in answer options. So this is where, and you see in the dark red, where you're able to see that, guess what? There are other things that are just as important, such as food and in shelter and clothing, reproductive, and safety, all that stuff that matters to patients that definitely could be priority as well. So I've given you some resources to be able to answer nursing questions. So now let's talk about some tips to answering these questions. So especially with these long case studies. So first, you want to highlight the actual question. If you can highlight, if you still got paper and pen tests, I think some computer systems let you highlight. But even if you have to highlight a mental highlight in your head, paraphrase it and make it understandable to you. Okay? Make it that you actually understand the question. Number 2, look for keywords that will guide you in your decision making. Need for understanding. First, priority, immediate, most concerned, indicates understanding. You want to eliminate distractors. Beware of negative terms such as never or none. And secondly, don't add to the question. Take the question as it is. And I said on here, don't add me to the question, meaning don't add you and your situation. Oh, well, they could. It didn't say that they were pregnant. They could be pregnant. The question did not say that. So don't add me. Don't add you to the question. Literally stick to whatever it is that it said. All right? Use the process of elimination and select the best choice. Again, beware of negative terms. So now let's talk about how to dissect these long case studies. So first, I say read the question first, then go back up to read the case study. Because when you read the question first, you kind of know what you're looking for. All right, note any pertinent information such as age. Remember, as the patient ages, body systems tend to slow down. Objective and subjective data. Always listening to the client. Always looking at the client. Drowsiness. Patient reports fatigue. High heart rate. Pale skin. Lack of appetite. Does any specific disease process come to your mind as you start to see all this data? Guess what? The wheels in your head just begin to spin and say, oh, this could be this. This could be this. But let me keep on reading. Time frame. How long has this been happening? Or like in the case studies, they love to give you, hey, this happened at 1 o'clock. This happened at 2 o'clock. This happened at 3 o'clock. Pay attention what happens in these time frames. Also, lab tests and values. Understand how disease processes and medications affect certain lab values. And Also, know your medications. Then, answer the question. Focus on one answer choice at a time. I always say if you have to place your hand over the computer screen just to look at one answer choice at a time, hey, do what works best for you. But sometimes with these case studies, you get so overloaded because there's so many answer choices. But what you want to do is focus on one. Cover all the other ones up and look at it and take the question as a true or false statement. Is this true? Okay. If it's true statement, all right, I can choose that one. But if it's a false statement, hey, I'm not choosing that one. So that's the way to take all these select all that applies, these case study type questions. You want to take them as true and false statements. And I've heard that that has helped students tremendously. All right, so we got some practice case study questions. Are you guys ready? I am. I'm excited. All right, I know it looks small here because we're in a viewing mode, but if you download the PowerPoint, you will be able to zoom in. All right, so I'll read the question for you. So this is a matrix multiple response question. It says at 1300 hours, an 86-year-old client with altered mental status who is accompanied by their child is admitted to the med surgical unit, and the nurse is performing an assessment. The client has an IV solution of 1,000 ml bag of normal saline hung at 12 o'clock in the ED that is infusing at 100 ml per hour. 1 hour after admission, the client child calls the nurse and reports that the client has a pounding headache and is having trouble breathing and seems scared. Okay, so are our wheels in our heads thinking like, what could this be? All right, so then you want to look at your nurse's note. It says at 1300 that the client is weak and reports have not being able to eat or drink in the past 3 days because of anorexia. Her skin is very dry. Her mucous membranes are dry. She's sleepy. The child reports that the client has a history of heart failure, hypertension, and hyperlipidemia. The breath sounds are clear bilaterally. The patient medications are lisinopril, cardovolol, and digoxin. At 2 o'clock, the client is dyspneic, meaning short of breath, and complaining of chest tightness. She is coughing and she is pale. She has neck vein distension. Breath sounds are wheezing and they can hear congestion bilaterally. There is only 500 ml of fluid remaining in the IV bag. All right, nursing students. So I hope your wheels in your head are starting to turn and be like, oh, I know what happened to this lady. I know what happened. All right. So we then look at our test results. So what I love about Next Gen is, guess what? They let you know the normal ranges and they tell you if it's high or low. So, but it's up to you to know what these lab values are associated with and why they would be high and why would they be low. So guess what? It takes some critical thinking on that part. So the BUN is elevated. The creatinine is elevated. The digoxin is elevated. The sodium is elevated. The potassium is elevated. Everything is elevated on her. Her vital signs, the only vital signs that seem to change from when she first got in there was her heart rate was 72. Now it's 110. Her O2 was 90. Now it's 89. Her respirations were 24. Now they're 28. And her blood pressure was 100 over 68, but it's now 152 over 98. Do we have any idea of what is going on with this patient? So now let's go to the question. So the question reads, for each assessment finding below, specify if it's most likely consistent with dehydration, circulatory overload, or digoxin toxicity. So here comes in where we need to have content on dehydration presentation, circulatory overload presentation, and digoxin presentation. It doesn't even say that the nurse gave the patient digoxin, but guess what? This would be a perfect time to see, do you know your medications? All right, before I shout out the answers, I'm going to give you guys a little time. I'm going to give you guys 30 seconds just to see if you can answer the question. And you only pick one per assessment finding. All right, so anorexia. Would you most likely see anorexia with what? Digoxin toxicity. Dry mucous membranes, we will see that with what? Dehydration. BUN and creatinine levels. Being that their levels are high, we're going to see that with what? Dehydration. Because now the kidney is not working properly because what? It is not getting enough fluids, right? The sodium and potassium levels, they are high. So we know that sodium is excreted through body fluids. So when your body is dehydrated, your kidneys are saying, guess what? I'm going to hold on to every ounce of fluid that I have. It goes into survival mode. And that's when all your electrolytes start to go. So you know how sodium follows water? Well, guess what? No water is being let out. So guess what? Sodium is being, sodium's not being let out because there is no water, right? So there is no sodium and water to follow each other. So guess what? Your sodium level is going to be very high because guess what? There is no water. Why? Because that patient does not have any fluids. All right. You're going to see, and all that is going to be in dehydration. Your digoxin level, that level is high. And guess what? We're going to put that with what? Digoxin toxicity. All right. You see an elevation in your blood pressure and in your heart rate. What is that? What caused that? Because when grandma came in, her blood pressure was low and her respirations were normal. As soon as they started those fluids on her is when everything changed. So I hope that you made that connection, that as soon as they started those fluids on her, everything changed. So that would be circulatory overload. Wheezing and congestion bilateral in her lungs, that's circulatory overload. And neck vein distension, that is also circulatory overload. So what might have happened in this case was, which happens all the time, we don't really dig into the patient's chart. So if we would have took in account, if we would have took in account the lady's age, knowing her kidneys probably, have slowed down. So guess what? They hold on to fluid. But most importantly, she has a history of heart failure. And we know with fluids and heart failure, if you don't run them super slow, they can be easily pushed into fluid overload. So you want to make sure that you are paying attention to their health history. Their health history is very important. They thought that they were doing good because her blood pressure was low and that she was dehydrated. They thought, hey, let's give her some fluids. But guess what? The fluids were running too quick. All right, let's move on to the next question. Great job. I believe you guys got it right. And here is the answer. If you want to look at it and zoom into the strategy of it all, there it is right there for you. All right, question number 2. So it says that a 68-year-old female complaining of chest pain is admitted to the med-surg nursing unit for acute coronary syndrome. The cardiologist prescribes a continuous IV heparin infusion per protocol. The client weighs 165 pounds, which is 74.8 kilograms, and baseline PTT is 32 seconds. All right, so let's stop right here. First of all, we need to know what is heparin, right? We need to know what is heparin, and we need to know what is PTT. If we do not have the content, the knowledge of those two things, guess what? We kind of screwed, right? So it says a bolus is administered as prescribed and continuous infusion is initiated based on the protocol noted on the patient's MAR. All right. So basically the MAR, it just goes to show you, hey, this is what you do when that patient PTT comes back. So we really don't have to read that now until the end. All right. So it says that the next day, the oncoming nurse assigned to the patient, they monitor the patient and checking their labs, right? The client says, I feel okay. I just had a hard time sleeping since I've been in the hospital. My chest pain is better. I had a nosebleed this morning, but it stopped. I'm ready for breakfast. It should be here soon. The most recent PTT was done an hour ago, and it was 92 seconds. The heparin infusion is still running, and it's running at 13.5 mLs per hour. So let's go back up with that 92 seconds, and let's go back up to our MAR. So our PTT says this is how long it takes our blood to clot. So if it takes your blood longer than 90 seconds to clot, no bolus and stop the infusion. What is heparin? Heparin is a blood thinner. All right. So the question then says, select 3 priority needs that are of immediate concern, meaning we need to do something about these 3 things right now. I'm going to give you guys a chance to answer. All right, so let's go back to the original problem, right? Let's go down to the paragraph at the end. So I'm concerned with this patient having a nosebleed. I'm concerned because this patient is on a blood thinner and they had a nosebleed. So before I even knew the PTT number, I knew that the PTT was going to be off. I knew it was going to be high because that patient had a nosebleed. So we need to pay attention to the nosebleed, the PTT, and we need to stop the infusion. So the answer choices: nosebleed, PTT results, heparin infusion. All right, let's talk about why the other ones are wrong. Appetite. The lady said that her appetite is better, right? She did that. She actually said she's ready for breakfast, right? With her chest pain, she said that her chest pain was better. You having a difficult time sleeping in the hospital? I'm sorry, that is not priority. So do you see why those 3 were chosen? In any other instance, chest pain would be a priority, but not in this situation because the lady clearly stated that her chest pain was better. All right, great job. I know you guys got it right. And here is the answer along with the rationale. If you want to look at it more, here it is right here. And like I said, you'll be able to zoom in on PowerPoint on your computer or your phone. All right, so we're going to do some standard NCLEX questions. I know that, next gen questions can be overwhelming, but guess what? You still will have regular NCLEX questions. So we're going to do a few of those. So it said, client rings the call bell and complains of pain at the site of the intravenous IV infusion. The nurse assesses the site and determines that the client has phlebitis. The nurse should take which actions in the care of the client. Select all that apply. Now you just like, Dr. Bonnet, you just said that. You was going to give us some regular questions and then you give us a select all that apply. Let me tell you something. The key to select the all that apply is taking them as true or false statements. So it doesn't say this question. I love this question. So first, you need to know what phlebitis is. Phlebitis is inflammation of the vein, and that happened from some IV solution or antibiotic. Anything could have caused it that they were getting through the IV. So inflammation of the vein. All right. So it doesn't ask you to say which one is priority. It just say which action should you take. So we covered up every answer choices, and we're going to focus on just one at a time and answer it true or false. Would you notify the healthcare provider? Yes. Because guess what? This was an IV complication that ended up occurring. So you should let the provider know. Now, do you need to let the provider know that be the first thing you do? No, you can do some rest of the steps, and then you can notify the provider. All right, but it's not asking you priority. It's just asking you what steps would you take, and we are going to notify the healthcare provider. Next, remove the IV catheter at the site. Yes, it has to go. So we would say that's true. All right. Apply warm, moist packs to the site. Is that true? Yes. In the hospital, we use a warm rag. But yes, warm packs. That's what you want to do. All right. 4. Would you start a new IV line proximal in a proximal portion of the same vein? No. Once that vein has been irritated, guess what? You need to go away from that vein. You need to choose a completely different vein. I like to choose the completely different arm. If there's nothing else on that arm, you make sure you're not in that same vein at all. And that comes when you still need your anatomy to know which vein it actually is and how far that vein goes up and all that kind of stuff. No, we don't want nothing to do with that inflamed vein. We don't want to mess with it anymore. Okay, so that's false. So would you document the occurrence, actions taken, in the client's response? True. So you would have 1, 2, 3, 5. All right, great job. Y'all are so smart. All right, last question. It says the nurse is assigned to care for a group of clients. On review of the client's medical records, the nurse determines that which client is at a risk for fluid volume access. So did I put fluid volume load access and circulatory overload in the same presentation? Yes, I did, because I want you guys to be able to put things together. So if I'm going to be worried about a client having too much fluid on them, who is going to be the client I'm going to worry about? Am I going to worry about a client taking diuretics? Dr. Bonnet, I don't know what a diuretic is. So this already puts me at a disadvantage because I don't know what a diuretic is. Well, a diuretic is a medication given to pull fluid off a patient, to get rid of fluid off the patient. So this patient shouldn't be at risk anymore because they're already on the medication to get fluids off of them. How about that client with kidney disease? So what did we say earlier? We talked about how when you have kidney disease, your kidneys don't work. What is the kidneys of our body? The kidneys are our filtering system. Our kidneys filters our body. But guess what? When our kidneys are not working, when our BU and our creatines are all over the place and our kidneys are not working, guess what? We start to hold on to a bunch of fluid. And as we start to, as you can see on that other question, they held on to sodium. They held on to potassium. Their BUN and creatinine level went up. So you want to make sure that your patients with kidney disease, you want to make sure that they're urinating. Now, if they're on dialysis, you know, they're not expected to urinate. But you want to always be paying attention to patients' kidney function, especially when they be on these antibiotics and they're on all these medicine that can cause damage to the kidneys. It seems like such a small task as a nurse to pay attention to urine, but it's so important. A client with the ileostomy, Well, that client, if you ever seen an ileostomy, those things are forever putting out output, forever putting out output. You forever have to change them multiple times a shift. They shouldn't have any problem with holding on to fluid. Or a client who requires gastric suction. Anytime we're taking, it doesn't even, anytime we're taking fluid away from a patient, it should, guess what? It should take them from being at risk for volume excess. So it's not saying just because you're getting gastrointestinal suctioning, and that's like, getting the NG tube or something, that doesn't mean that you're not going to be at fluid volume. That doesn't mean you can't be, but the likelihood of you being at in overload is low, because guess what? It's sucking everything on out you in your ileostomy. Guess what? All your insides is a hole in your ileum, and guess what? It's just seeping out. You're getting rid of fluids. Diuretics, you're getting rid of fluids. So in all these options 1, 3, and 4, everybody is getting rid of fluids on them, except this client with kidney disease. They may have a problem getting rid of fluids.